Cancer. It may be the most frightening word in the English language, but a cancer diagnosis today is much different than it was 10 years ago or 20 years ago. New breakthroughs like CAR T cell therapy are saving lives.
CAR T therapy is a new type of treatment. It stands for something that sounds very complicated, chimeric antigen receptor T cell, but it's not actually that complicated. It's a type of therapy for patients where we take a patient's immune cells from their blood, and then in the laboratory, we engineer them to be able to go back into the patient's body and home in on the patient's cancer and kill the cancer.
Describe the process.
So the process is a patient comes to a clinical area that we have over at the hospital of the University of Pennsylvania. Patient sits in a chair and has IVs put into their arms. And from their blood, we take out a certain type of white blood cell using a machine. And then the patient goes home. And we have a bag of cells now from the patient. And we take that bag of cells over to our laboratory. And in the laboratory, we do a number of things to the cells so that they will start producing something that they don't naturally produce. They start producing something that will enable them to recognize cancer in the patient. And after we grow up these cells in the lab, we give the patient back their own cells that have been changed, modified, to be able to recognize their cancer. And they go back into the patient, circulate around, find the cancer, and kill it. What actually we do with the cells in the laboratory in order to get the cells to be able to recognize the patient's cancer is we use a virus to infect the cells, to put a gene, to put DNA into the cells that will cause the cells to express a protein on the surface that will help the cells recognize the patient's cancer. And this virus that we use, interestingly, is HIV virus that has been changed so it can't cause disease, can't cause HIV, but it can be used as a tool in the laboratory to introduce this genetic material into the patient's cells.
Could it be used as a vaccine against cancer in the future?
Absolutely. So the way it stands now is that because it's experimental and it's new, it's being used on patients who have cancer already. In fact, people who have cancer that is very advanced, and all conventional therapies have failed. But once it becomes more, we've had more experience with it, and there's more is understood about potential side effects or this, that, or the other thing, then one can begin to think of first using this as a first-line therapy for cancer. And then once that proves to be safe and not too expensive, then one can think about actually using it as a vaccine, in other words, to prevent cancer from occurring in the first place. That would be the eventual goal.
Does CAR T cure cancer?
It's always difficult to say that you've cured cancer because you only have measurements you can make that are only sensitive to a certain degree. But in many patients that we've treated, there doesn't seem to be any evidence that can be detected in any way that the cancer is still there. So we hope that these patients have been cured.
Are there side effects?
The side effects generally are caused by an incredible burst of activity in your immune system, which cause a drop in blood pressure, can cause various neurological problems from occurring, things that affect basic processes in your body, hemodynamic things, your as I said, your blood pressure and so forth and so on. Just extreme activation of your immune system can set off various types of systems in your body kind of going haywire.
Why does it work for some cancers but not others?
It all has to do with the design of the CAR T cells to teach the CAR T cells what to recognize. And so for leukemia and lymphoma, we know what to teach the T cells to recognize to kill that kind of cancer. Those CAR T cells wouldn't be of any value in treating any other kind of cancer because every cancer is different in terms of what it has on its surface. So what we are doing now, and we have some good ideas and they're being tested in patients, is making CAR T cells that recognize different things for different kinds of cancer. So hopefully we will have CAR T cells that will treat many, many different kinds of cancer.
What's on the horizon for CAR T?
A couple of things. First, of course, trying to develop CAR T therapy for cancers other than leukemia and lymphoma. So we have clinical trials now looking at multiple myeloma, trials looking at brain cancer, looking at prostate cancer, looking at pancreatic cancer. So on the horizon, we'll be expanding this therapy for other kinds of cancers. One other major thing to look forward to is where the drug is made from the patient's own cells. I initially said the patient goes and sits in a chair connected to a machine and we take out some of the blood from the patient, and that's what the starting material is. Well, what would be ideal is if you didn't have to make the drug from the patient. What would be ideal is if you could make the drug from just a healthy donor. In that case, the drug would be already available on the shelf when a patient needs it. You wouldn't have to first decide that the patient should get this therapy and then subject the patient to having cells collected. The patient has to wait several weeks before they can get the drug because it has to be manufactured. Some patients can't wait that long because they're too sick.
Right.
So the ideal thing in the future is to have what we call universal CAR T cells, cells that are made from healthy people and that are just like blood in a blood bank that are donated, by healthy people. So it's right there ready if a patient needs it.
Just incredible. Next, another game changer in the fight against cancer today. Radiation has long been a weapon in the fight against cancer. But traditional radiation therapy often killed healthy tissues along with cancer cells.
So on March 28th, which was 2015, I got a call from Dr. Weber, Christy Weber, and she had the news that, Ariane, I'm sorry to tell you this, but you have cancer. And she said it was liposarcoma, which is very rare and aggressive cancer. And I was at a conference in New York, and I was pretty devastated. I felt like, whoa, my whole world was turning upside down. I'm getting married in 2 months. I was planning my wedding, and everything seemed to be on top of the world. I was always very active as a kid. I really got into anything and everything growing up, from cheerleading to gymnastics, not things that I necessarily loved, but tried them out. I really wanted to be a role model and wanted to show people that it's more than about being skinny, that it's really about being healthy and fit. So I really started to kind of take off from there, and then I opened my own fitness studio.
Ariane was in her late 20s and in peak physical health. The last person one would think would be diagnosed with cancer.
Ariane's cancer was quite rare. She had a liposarcoma, a type of sarcoma of the thigh. And just to be clear, sarcomas in general are extraordinarily rare. So in this country, we see between 8,000 and 11,000 sarcomas each year, as opposed to if you look at lung cancer, breast cancer, GI cancers may be on the magnitude of over 100,000 cancers a year.
So the treatment plan after we found out that it was stage 3 and it had the round cell component, which meant that it was sensitive to chemo, the plan changed. So that meant that I was starting with chemotherapy and then moved to radiation and surgery. When I started chemotherapy, I did 3 rounds of it, and very aggressive. And that was right before my wedding. So they were very accommodating and said, you know, you can still get married. You can go on your honeymoon. So we would, you know, work on the schedule to make sure that you could do all that. So when I came back from my honeymoon, I showed up for chemo, and they said, you don't have an appointment. And I said, oh my gosh, yes, I do. So what happened is the tumor was getting bigger. And so they had an immediate switch to radiation. And I had already met with Dr. Levin at that time, and he said that proton therapy would be a great option for me.
Protons are a type of radiation. They actually interact with the tumor cell's brain, the DNA of the tumor cells, and break that up. But unlike a regular radiation beam that treats other things, it just goes right to the tumor itself. So we can concentrate the radiation there, and we can do special things because of that. We can give higher dose to a tumor than we can with conventional radiation, and we can combine with other things like chemotherapy or immunotherapy in ways we couldn't do safely before.
Now explain the process a patient goes through.
Many times we bring a patient in first for a planning session or a simulation where we may do a combination of imaging techniques like a CAT scan or an MRI or a PET scan, and we'll mark out the area that we want to treat. And then with our physicists, we figure out what's the best type of radiation to treat that area best by giving the most dose to the tumor, but the limited dose to the normal tissue around that. And that sometimes it's protons, it's sometimes conventional radiation, and sometimes a combination of those things. So we use our computers to figure out the best way to develop that plan, and then we bring the patient in for the treatment itself. The treatments, patients are usually here for about an hour, in the door, out the door. Most of the time, the patients are in the room getting positioned in the right position. The beam is only on for a minute or two. They don't feel anything when the radiation's on at all, but they get the radiation dose and then they leave the room. Some patients will get treatment over a week, some up to 6 or 7 weeks, and it all depends on the type of tumor that they're being treated for.
I just felt like the whole experience of going through the entire session was great. The sessions themselves were super quick. I don't remember exactly, but 10, 15 minutes or so. So it was very efficient. And that was actually the time where I decided to start training for American Ninja Warrior.
You heard that right. While going through proton therapy, Ariane trained for the TV show American Ninja Warrior.
My husband introduced me to American Ninja Warrior when we were dating. And he said, you need to be on this show. And I was watching it and I said, yeah, I do need to be on this show. I said, this is pretty cool. So really how it happened was life was going on, got cancer, got married, and at the same time, there had been this local gym that had opened, which was the Ninja Gym, iCore Fitness. And I said to my husband, I said, I think I'm just gonna go check this out. I said, if I like it, I might pursue it.
I basically said, why don't you take it easy during the treatment? To which she gave me a coy smile, and only in hindsight did I find out what it actually meant. So each week I would meet with Ariane during the 5 weeks and say, how are you doing? You know, she would say she's doing fine. I would ask her if she's doing any sort of activity outside of her radiation treatments, hoping at least that most of my patients will be walking around the block or not just sitting on the couch.
One day after radiation, I decided to go to the gym and check it out. And I walked in and I said, hi, I'm Ariane and I'm interested in training for American Ninja Warrior. And he said, the owner, Mark, he said, awesome. He said, that's great. And I said, well, I do have a few things going on. I said, I'm in proton therapy. I'm getting surgery in a few weeks. I have chemo scheduled after that. But I said, I think we just need to work around a few things. So he said, great, let's start Tuesday.
The training did not stop at the gym. Ariane would bring kettlebells to work out during her chemo. Working with Ariane has changed the way you are approaching cancer treatment for future patients.
Once Ariane showed me the video, the YouTube video of what she was doing during the treatment, and kind of reconciling that with the fact that she really did very well. She had very few side effects, if any, during the treatment, as opposed to some of my other more sedentary patients. I thought that maybe there would be a therapeutic benefit to actually increasing the level of activity for our patients. So now there is some initial evidence that carrying on a more active activity level during the treatment actually may promote better healing and lifelong better function by carrying this out.
One of my most cherished roles is as the family liaison with patients at the Roberts Proton Therapy Center. So many success stories. Coming up, a new way of seeing tumors that's improving treatment. When surgery is required to remove a tumor, the goal is to remove all of the cancer cells, thanks to tumor glow. That just got a whole lot easier.
In 2007, 2008, I was interested in this problem of cancers that would come back after surgery. And I felt that as surgeons, we had to do a better job of removing cancers and making sure that we didn't miss anything and the entire cancer had been taken out. We eventually developed a dye, a contrast agent. It would go to the cancers and it would make the cancers glow. And by making the cancer glow, we felt the surgeon would be better able to completely remove the cancer and see the edges. And even after the operation was done and the surgeon thought they had removed everything, if there was any other spots that were glowing, the surgeon could look at them and make sure there wasn't cancer left behind.
Now, how did you come up with the idea?
My story goes back to May of 2007. When I was in training, I was finishing my training, and we had a Penn student right here, a college student, who was a runner, never smoker, and she developed lung cancer. We took her for surgery, and the operation was very successful. We thought we had completely removed the cancer. We told the family everything was fine. Unfortunately, 3 months later, the patient came back and had recurrent cancer. She was a young woman and she had cancer right where we had been operating. It had come right back. I went home that night and my baby girl was asleep in the crib, and I went to lay down next to her for a couple minutes. I noticed my wife had put these glow-in-the-dark stickers on the ceiling. I had a thought at that moment, it would be great if we could make tumor cells glow. Because if we could make tumor cells glow, then we wouldn't miss them, and we wouldn't have missed the cancer on this young woman, and she maybe wouldn't have had a recurrent cancer. The idea came at that moment. In terms of how we came up with the dye, and we essentially went back to the literature and researched different fields. We did experiments on fireflies, near-infrared imaging, similar to what they utilize in satellites to measure environmental dust. And so once we had the idea of what we wanted to accomplish, we were able to generate ideas from from the scientific community.
How has it improved precision and accuracy for the surgeon?
By doing tumor imaging in the operating room, we can map out where we left cancer cells right then and there while the patient's still open, while the patient's still asleep, and remove more to confirm that the entire cancer has been removed. Patients walk away knowing that not only do we get that cancer, but we had a good, confident look at the rest of the organ. It also gives us the opportunity for patients who typically would have maybe gone surgery and then maybe needed radiation to do a better margin operation and avoided some of these extra procedures. The other area that has also been beneficial is we can do many more directed operations. So previously, without intraoperative imaging, we didn't always know exactly where the cancer is. So the benefits of this technology have come in many different flavors.
How has it improved patient outcomes post-surgery?
In our experience, it depends on the type of cancer. So, for example, for a cancer called mesothelioma, we're finding that almost 80 to 90% of the time, we are missing cancer deposits at the end of the operation. For lung cancer, for very small lesions, we're very successful with tumor glow. Typically in a clinical trial, once you collect all this data, you would go to the FDA and you would try to get approval so it would be so that anybody around the country could use it. So we're in the process of both doing larger studies and collecting follow-up data on the patients that we've already done. I suspect in the next 6 to 12 months, several institutions, such as St. Jude's Hospital in Memphis, Tennessee, have approached us about starting their own programs. Another place is Stanford has looked at how they can use tumor glow. So institutions are slowly showing interest and learning how to use this technology.
Who are the best candidates for tumor glow?
So any patient is a candidate for tumor glow. Over 900 patients have been treated at Penn with tumor glow, with 14 different surgeons in 12 different cancer types. So we've grown significantly over the last couple of years as surgeons have started to like the technology and feel that they do a better operation with the technology.
How is a cancer diagnosis today different than what it was 10 years ago?
Cancer diagnosis has evolved and improved significantly. For surgeons, we depend heavily on preoperative imaging, CAT scans and PET scans. And those scanners are getting better and better. You can get 1 millimeter depth CAT scans very easily now. So we can detect lesions smaller and smaller. I also think what's happening is more and more patients are getting CAT scans because they're much more affordable. And people are getting CAT scans for several reasons unrelated to looking for cancer. And so people are being detected earlier. And because people are being detected earlier, they're coming to the surgeon at earlier stages, which is helping.
Think of the breakthroughs yet to come. Coming up, more on cancer survivor Ariane Nissenberg. Ariane's commitment to health and fitness has only strengthened since her personal journey with the disease. Now she's sharing the lessons she learned with others.
I have always loved being active, and I never really thought of it as exercise. I just thought of it as just moving through the world and enjoying it and being happy doing that. But I think that as I got older, I think movement has really healed me in so many ways. So I got the call from American Ninja Warrior in May of 2016, 3 weeks before the show. They said, you know, Ariane, this is from American Ninja Warrior, the cast, and we just wanted to say that we'd love to have you on the show. And I just started screaming and jumping and screaming and jumping, and I was so excited. And she said, do you want me to call you back? I said, yes. So she gave me 5 minutes to collect myself, and then we talked again. She gave me all the details, and it was amazing. Training for American Ninja Warrior was definitely a lot of obstacle training. So that was the thing that I had not done and not practiced before. So I've been working out my whole life, but I have not worked on those types of exercises. So it definitely was a lot of that. I did a lot of like calisthenic work, plyometric work. I started rock climbing, some gymnastics type work as well. So I just kind of kept adding things. So 2016, I just feel like that's all I did was work out, but it was amazing. I'm such a believer in movement, and I think that when I have patients that have just been diagnosed call me and they're kind of looking for some advice, I always say, you know, if you can move, please move. Because even if you feel like crap, movement is going to help you emotionally, it's gonna help you physically, it's gonna just give you energy to keep moving forward. I think my experience has helped me in so many ways in life, not just with treating patients, but my relationships with other people. When I'm working with people now, I'm really able to help them on a lot of different levels. But if they know my history and my story, then they know that I've been through something too. So there's this mutual understanding and respect. And I think that people also realize, wow, I can get through this too. I have so many tools right now from a professional standpoint, but then also a personal standpoint, that I can really help people heal in so many ways and be able to use nutrition and movement and mindset to really kind of bring all that together to help people really get where they need to go. I think the best part about it was that it was such a personal victory. I know that everyone thinks, wow, American Ninja Warrior is so cool, and it is so cool. But for me, it was such a personal victory of, wow, not only did I beat cancer, but here I am standing with some of the strongest and fittest people in the country, doing the hardest obstacle courses you can do. And I just felt like, wow, I didn't just survive, I thrived. I am cancer-free, so in a few weeks it's gonna be 3 years, which is so exciting and so amazing. And I just feel like it's been actually a very incredible journey since then, during that and since then. And I hope it just continues to evolve.
Wishing her the best of luck. Thank you for watching. Until next time, I'm Suzanne Roberts.